the main placements we get are in the clinical years, because that's kind of the bit we do the actual medicine. So 4th, 5th and 6th year, which mainly most of the year is spent in a placement in the hospital, between UCH in Warren Street, the Royal Free in Hampstead, and the Whittington and Archway is the main sites, but you're also in other places. But in the beginning, in the 1st and 2nd year, we do get the odd day or two placement in hospitals, just get a bit of an exposure to it.
Now I'm in 6th year, I've had lots of different placements. Some of the placements are in the main hospitals, so like UCLH, the Royal Free and Whittington Hospital. And then we also have placements in further hospitals away, like DGHs, and GP placements as well. And what we do on placement kind of varies. So sometimes you're practicing your practical skills. The main thing that we do is junior doctors will direct us to patients that they think will be interesting for us to see. And we go and chat to them, and it's quite informal, it's really nice. Get to know them, you have much more time than other doctors, and sort of practice what you need to do to be a doctor, but also get to know people. And you can do it in pairs as well, which is nice at the beginning.
So one of the placements that I had, it was after exams, and we were based in the orthopedics department for half the day, and we were following a junior doctor around, just shadowing him and seeing what he did on a day-to-day basis. And it was quite interesting because a lot of the things that we have learned in 1st year directly applied to things in a hospital setting. So a lot of anatomy and physiology I could actually apply and relate to what was going on in the hospital setting. Also things like different types of drugs and how they worked. He actually asked, what does this drug do? And why would I give this drug as opposed to this one? And it was quite interesting to see how what I was doing in lectures and what I was doing in labs was actually being used in an actual hospital. So yeah, and we went into a briefing where we saw the consultants look at x-rays, and they set out their plan for the day, and everyone was delegated particular jobs. And following the actual junior doctor around, he had loads of different responsibilities, from note-taking to taking out stitches, administering medicine, checking up on patients and all those things. So it was quite interesting, quite full on, but it was interesting.
So with regards to placements during my academic career here, as part of the whole medical school curriculum, you have to cycle through different specialties in different hospitals over a set period of time. There's not a lot of flexibility in that, but you do get to see medicine and healthcare being practiced in a variety of ways, in a variety of environments. In my GP placement, I was placed in Uxbridge, which is a totally different socioeconomic demographic than Camden might be. So you get to see a different type of patient. They come in with different concerns and different conditions that you need to address. With regards to academics, I did my BSc in neuroscience, and so UCL afforded me really truly tremendous placements for laboratory-based neuroscience research here at UCL. They've got the Institute of Neurology here. We have a professor with a Nobel Prize in neurology. We have tons of different labs to choose from. People who have really pushed the envelope and defined the field of neuroscience work here and developed UCL as a research institution. And so if research is your interest, laboratory work in particular, you'll find tons of placements here that will afford you those opportunities.